Hi, I'm Dr. David Newman, and I'm a plastic surgeon in the Temecula, Murrieta area. I'm answering some questions that patients have about breast augmentation and other forms of plastic surgery. One of the most frequently asked questions about patients who come in for breast augmentation is how we pick the size for patients and how we make recommendations for surgery. I think it's important to understand that different sizes make different shapes. Not all sizes are best for each patient, that each patient has a best size or a best size range. I like to start out by asking patients what size they would like to be, without my telling them. That way I can really find out what they want. Next, I examine patients and look for the best volume that will get out to the edges that the natural breast is at. For example, we like to have cleavage in the center where there's some narrow space between the breasts. They don't have to be touching, but it's good to have some relations in the center. We also like to have the breast volume coming out to the side. We like to have breast project in a good amount, and we also like to fill the upper pole of the breast. Once we take that into account, we've arrived at the optimal volume for each patient. Naturally, the wider the chest, the more volume is required to achieve even the same cup size. So the choice of the implant determines a lot about how the breast is going to look. So patients who have not a lot of breast volume have a higher chance to be able to feel the implant. And so in those patients, we like to use silicone implants because the silicone implants feel more natural and they look more natural. Another common question is whether patients who have breast lifts need an implant. And the simple answer is that for patients that want to have a youthful breast, where there's fullness in the upper part of the breast, an implant is really necessary. Patients that have drooping require a breast lift, but the lift itself doesn't increase fullness in the upper part of the breast. To get fullness in the upper part of the breast, you need to have an implant under the muscle. The muscle acts like an internal bra and supports the implant and pushes the implant up to create fullness in the upper part of the breast. So for patients that have drooping and they want fullness of the upper part and they want a natural look that's youthful, it's important to do the lift with an implant. The implant doesn't have to be large, but it just has to be wide enough to get across the top of the chest. Thanks for watching. I hope we've been able to answer some of your questions. I'm Dr. David Newman, board certified plastic surgeon.